Hi, my name's Eleanor Hayes from Birthzang, and today I want to talk to you a little bit about what to pack in your hospital bag. If you've decided not to go for a home birth, and many first-time parents prefer to give birth in hospital, you'll probably start thinking, maybe from 34, 35 weeks, about what to start packing in your hospital bag. Now, the list of things that you can pack is quite exhaustive. Some people have the philosophy that you really don't need anything at all, and some people have about 5 suitcases. I personally was one of the 5 suitcases kind of people, but I always like to have more things than I need. I'm not going to tell you today in this video exactly what to pack in your hospital bag, but just a few pointers as to how to get started. First of all, I think the best thing to do is to divide your hospital bag into sections. So either have different bags for different things, or have one big bag with lots of smaller bags in them. That way you can get what you want really quickly and easily without having to rummage around. The first section, or the first bag, I think should be a bag that you can use during labour. So having things that are going to help you during the labour and up to the point of birth. So for example, you might have your TENS machine. If you're going to use one, you might find you've got some aromatherapy oils that you want to have, comfortable clothes to wear, that kind of thing. The second thing is the point from birth onwards, and here again I think it divides into two more sections. So first of all, have a section or a bag for the mum and what she's going to have in the 24 hours post-birth. So you're probably going to want something to change into, some nice a nightie with perhaps a good opening so you can have breastfeeding and skin to skin, for example. You're going to want to have sanitary towels, and things like that that are just for you. You're going to want to take some cosmetics and wash things so you can have a shower or bath straight afterwards, that kind of thing. But also we want to have stuff for the baby. So we're going to have the first kind of outfit the baby is going to wear. You want to have newborn nappies, some muslins because they're going to vomit probably and going to poo because that's what babies do. And all the things that you might need for the first 24 hours or so. It's probably an idea to have one or two changes of clothes for them, just in case they do vomit over everything. So then the third kind of thing you want to do is to think about if you end up having a longer stay. Now, if you have an uncomplicated delivery, then you can leave, a couple of hours after birth. You don't have to be admitted at all. But many people do prefer to be admitted, particularly if it's late at night or if they, needed a bit of stitches, or if there's any concern about their baby. That many people will stay for a day or so. But most people are discharged within 24 hours. If you do end up staying longer for whatever reason, particularly if you have caesarean birth, you may well find that you're advised to stay in for a couple of days, if not two or three. Then you probably want to have another bag that you can almost just leave in the car and get in the event that you do stay a bit longer. So again, you want to think about things for the mum to wear, a few more, pyjamas or loose, comfy clothes. Couple of magazines, that sort of thing, and also stuff for the baby, so more muslins, more nappies, more baby grays, that kind of thing. Finally, you want to think about your birth partner. So throughout all of the birth and in that early postnatal period, you've got to think about your partner as well. If you have a long labour or if you're overnight, they might want to have a change of clothes as well. And they may want to, have a wash kit, something like that, and anything else they want to bring. Finally, I think it's really important to take food with you. And many times in hospital, you're not really advised to eat during labour, but unless there's a specific concern about the fact that you may, at high risk of needing a caesarean, then to be perfectly honest, it's much better to keep nourished. And that goes for the birth partner as well. And what mum is going to want to eat during labour and what dad is going to want to eat during labour may well be quite different things, because when you're in labour, quite often you can't eat very much. You want to take small mouthfuls that don't require much chewing. Melon, for example, cut up into small pieces is a really nice one because it really hydrates you as well as just giving you a bit of nourishment. Whereas, dads might want chewy muesli bars or something with a bit more substantial. If you also end up having your baby in the middle of the night or in the evening, you might find you miss a meal and there's not any food available to you till the morning. So it's quite a good idea to have a few snacks of things that you can eat in the middle of the night in case you feel completely starving. And then finally, you must remember that if you're going to be driving, you need to make sure that you've got your car seat in the car and that you know how to use it and you know how to put your baby into it. Anyway, I hope that's given you a good starting point for what to pack in your hospital bag. I've written an extensive list, an extensive blog post on all the things that you can choose to take or may not want to. And so you can find that on my blog, and I'll list the address for you in the newsletter as well below. Hope you have a lovely week and enjoy packing your hospital bag. Bye.